Sarah Ashley. Here. We don't have student reps yet. But as soon as school is back in session, I'm sure we'll
Public participation. Approval of minutes for the 879th meeting and the 880th meeting.
So moved.
Second.
Any discussion? All in favor? There. Vote.
Oh, I have to now. Sorry.
Unanimous?
You could have at any time previously.
Yeah, those flexing.
Approval of financial statements
We
for
don't have,
June 2020.
we don't have them ready, so we're gonna have to check.
Superintendent's report.
So I'm gonna share my screen, and you have a packet, I believe at the bottom of your packet, you should have a handout. This is our initial draft, if you will, of our reintegration plan. You've already seen several slides from this plan, and what we'd like to share with you tonight is what we've worked on since then and where we're going from here. I'm going to skip through the first few parts. You've seen our return to school roadmap. You've seen our plan for teams and who our teams are and what the team focus is. Those teams have been meeting regularly. We shared with you the reintegration timeline, and this plan right here showed you the different stages of our timeline, moving from resumption phase to reconstitution eventually. We are now in past the resumption phase, which was getting us out of the last school year, and we have now moved into recovery phase, and that's what I'd like to cover with you this evening. The recovery phase does comprise of these different sections: teacher readiness, return to school surveys, health and wellness advisory, COVID-19 impact, and then a communication plan, which is highlighted by our parent guide. And we'll cover those all tonight, starting with the teacher readiness. For teacher readiness, this is basically to highlight the work that we did with our teachers on the last days of school, the last 8 days, and we are going to continue building up their capacity for readiness this summer, and also the first few days of workshop days when they return in the fall. And the focus was on these 4 major subjects. Subject 1 is the return student remote learning plan report. Every student in MSAD27 has a report that was made on them from last year's teachers. The pre-K 6 teachers did it for their individual students because they work with individual students in their classroom. Middle high school teachers did it per class that they teach. In any essence, every student has data that the teacher from last year basically is providing to this year's teacher, so that we have a snapshot of how did the learner do in remote learning? How, what did they excel in? What did they struggle with? And what are some needs that student's going to have? So that's something that we wanted to have ready for our teachers this year, so they have a good idea about those kiddos. Our principals have these learning plans right now, and they're going to be disseminated to the teachers very soon, so they can start learning about their incoming students. Part 2 is the refining remote learning phase, where we sat down with our return to instruction team, a subcommittee of our full committee, which is essentially a group of teachers and guidance counselors, and they established a set of core values for standard operating procedures that every student will receive in the event that we have to go back into remote learning, or if we have to go into a hybrid in and out of remote learning, or if we have some students who are going to have to be remote learners because of their health needs or whatnot. We felt it was going to be very important that we have a set of, just like our core values that we have in school, we have remote learning values. So they're aligned to our core values of respect, responsibility, honesty, and engaged and invested learning. And it goes down with the different expectations that learners should have on video chats, on attendance, on all the various aspects of remote learning. We also followed through with a set of standard operating procedures for our teachers. We felt that was really important, and the teachers gave feedback, on themselves and their peers about what they feel is really important to the profession with respect to remote learning. So that's all data that we've collected, and we've created artifacts that we will be sharing with you guys during our next meeting, so when that's ready to share out. Plan 3 or part 3 is the live instruction flipped lessons. Every teacher knows it will be an expectation that they have regular communication via live chat if we have to go back into remote learning, or if we have some remote learners. Also, with regards to flipped lessons, they've been trained on different tools on how to create videos, save those videos, and then house those videos somewhere like their Google Drive, so that when they're creating their Google Classroom, which I'll share with you next, they can embed those videos. So a student who may have missed a lesson can go back and watch those videos at another time, so that you don't necessarily have to worry about, being gone because you're sick or you have a doctor's appointment. You can have access to those lessons at another time. Or if you forget what the teacher said earlier in our live chat, you can go back and rewatch those videos. And then the fourth part is Google Classroom. Those of you who've taken a college class, you know that when you go log into your college classroom, you're always logging into a similar portal, be it Blackboard or be it whatever kind of system the university is using. We wanted to have a district-wide portal that the students would access or the parents would access, so that we're not all over the place with different programs and different things. So Google Classroom is the program we've trained our teachers on, and it's the way it was explained to them is Google Classroom is now your virtual classroom. So if you think about the regular school day, students walk into your physical classroom. We want your students to walk into their virtual classroom first, and from the Google Classroom, you'll have your assignments embedded there. You'll have links to go to different places, and you'll have access to the classroom calendar and all of the different things that are right there. For pre-K to grade 2, that's going to be very, very helpful for parents, because they're the ones who need that information, because the littles can't do that. For grades 3 to 12, it's going to be important that we're training our students on how to access their Google Classroom and how to manage it. So these are the 4 pillars, if you will, of teacher readiness that we focused on, and we're very proud of the work that's been done with regards to that.
Ben, are you having parent tutorials associated with these?
We're going to be creating a house of parent videos so that we can send them here if they're confusing.
Can I suggest having a parent learner conference day or whatever? What do you guys call it when you have your professional days?
Yeah. What we're actually going to propose this year is our open house is going to be a virtual open house, where our teachers are going to basically outline all of these things, where the parents are getting that information. This is only if we're going remote. So we're talking about what if, but we're hopeful that the remote learners are going to be less than they were this spring. But absolutely, you're absolutely right. Training the teachers, parents, training the learners is going to be a key aspect on making this work. Yeah, you're welcome. The next part is our return to school surveys. I gave you access to the surveys. You should have had handouts to them when it was delivered to you by Jackie last week. So you've seen the survey data results. If you've gone through the parent surveys, you probably read through the comments. Listen, we're not making everyone happy no matter what we do. If we say thou shalt wear a face mask, there's a group of people that are going to be very upset with that. If we say thou shalt not, we'll have an equally upset group. So we're going to have to be mindful about how we proceed, and having access to CDC guidelines, the American Pediatrics guidelines, the Maine Department of Education guidelines. That's going to be very important for us, so that we're not going at it alone. But we think that we have enough from the survey data to make some valid decisions. And I just highlighted a couple of survey questions. I'm going the wrong way here. These are 4 surveys that we put out. Or 3 of them we put out and 1 the department put out. A parent survey, a return to school teacher survey, a teacher readiness survey, and then the department put their own survey. And we'll share with you the results that the department gets when they share that with us. A couple of questions that I just wanted to highlight. The first one is from the parent survey. If the governor allows schools to reopen in the fall with appropriate safety precautions and safety measures in place, do you plan to send your children to school? And you'll see from our district, we have 13% that are saying no and 87% saying yes, they would send their school. Right in line with our Valley Unified partners, very similar responses. So you can see that if schools are allowed to reopen in whatever way, shape, or form, a vast majority of our parents want their children in school. Later in the survey, though, there was a question that you can tell made some parents kind of go the other direction. If given the choice, would your children choose remote learning over attending school in person? Please note that if this choice was made possible, remote learners may be required to follow a school schedule from home. So now we're asking, if you're given a choice, however, let's say remote learning is available and school is available, what are you going to choose? And for SAD27, you'll have to look at your handout for that number. There was 589 students represented, and 129 of them, which is 22%, would prefer remote learning if given the choice. So right around the same number, about 22% would opt to do a remote learning. And we feel that given the health needs, the family needs, and all of the different things, that's probably going to be a realistic reality for us to consider as we're thinking about when kids are coming back.
What was the age bracket? Did you break it down like that 22%?
We can break it down further. It's a ton of data, so we haven't got into the grade level specific, because what we want to do after we get approval from you guys to move forward, we're actually going to have parents like register their kids for A or B, and that will know which kid is opting for what, so that we can make decisions about this classroom and that grade level. It's going to be really important. For now, we just wanted a gauge. We wanted to know across the board, what did it look like? Teacher survey, if given the choice to be in the classroom teaching students or at home remotely teaching, what are you more likely to choose? And for SAD27, it's about an 80 to 20% split. And as the survey goes on, there are questions about health related, and the teachers are aware that no one's going to be able to choose just because they're going to be able to choose. But if they have to choose because of health reasons or childcare reasons or whatever, would they choose one or the other? So about 20% kind of matches our student population. So we're kind of looking at it. It would be nice if our remote learners are being taught by remote teachers. Our in-classroom learners are being taught by in-classroom teachers, so that we don't have the madness. Now, obviously, that's not going to work perfectly, especially in a high school level when you have subject content area professionals. But at an elementary level, all of our teachers are pre-K or K to 8 certified, so you can kind of cross over the grade levels when you're looking at it. So just data for, food for thought. I encourage you to go through the copies that you got thoroughly. If you haven't, the comments are always interesting, really interesting. And you have to take that with, a grain of salt. Our principals have been meeting this week. They're going to be meeting with their curriculum leaders, and they're sorting through this data, and they're bringing this data to a meeting that we have next Tuesday at the Tech Center, where we're having basically a data dissecting session, so that we can basically iron out how many teachers we're going to need in the classroom for how many students teachers are going to need remotely for how many students, and then start to put that all together so we can come up with a more concrete plan moving forward. The sixth part of this is health and wellness safety advisory. And what we've done is we've partnered with Northern Maine Medical Center to have them provide us with a school physician who's going to help meet regularly with our health and wellness advisory team, also consult with our school nurses on an ongoing basis. Our school nurses were ecstatic that this partnership was formed, so that we can have that two-way communication. And we actually had the first meeting today. Peter met with one of the physicians, or multiple physicians today, with Dr. Hart today. And so we're very happy that this partnership has been formed. And just to highlight a couple of the services in the partnership, provide consultation to the school nurses, participate in the school health and wellness advisory team as needed, and then advise schools on safety measures to be implemented and maintained specific to this pandemic. Like I said, we're very excited, and we're hopeful that that this partnership will provide us with the information that we need as we make big decisions about reintegrating the school. And I'll get back to this in a little bit later for approval. Toby?
What's the deal with the nurses right now? When I see nurses, we have one nurse. Are we gonna get the 1.5 nurses we originally wanted, or we're gonna keep one nurse?
Right now, we have approval, we have one nurse. The provider that provides to us will not provide us with a half nurse.
I think we need to deal with that. I mean, I know that when we've got a great nurse, but when she's out, there's nobody to do. Especially in the light of what we're dealing with, it seems silly for us to go in without that. Is that something we're in a position to discuss with this Fish River that provides it?
Fish River will provide us if we speak with them about providing another nurse. They will provide us, I believe, with another full-time nurse, but not a half-time nurse.
Do we have a contract with them?
We do. We haven't signed it yet for this year, I don't believe, not yet.
Do you think maybe we should address that as part of this? Because I mean, if we end up being, I don't think it would be realistic to expect our school nurse to have less work than they did last year. Right?
Yep.
And we were kind of, I felt like just watching what was happening with only one nurse on staff for the entire district, it felt a little short. I think we identified as a board, we needed 1.5, as I understand it. Fish River didn't want to provide the half, so they told us pound sand. But it feels like we should explore that further, because it's not going to get easier.
What we could do, given the fact that we haven't budgeted for 2 nurses, we could, I could speak with Fish River Rural Health if they have a nurse available, and we can potentially earmark care funds for that, because this is specific to COVID-19.
How much are we paying? I'm sure you don't know. Maybe we should explore how much we're paying for the contract.
Yeah.
Because it's troubling to me that we can just not have a nurse one day. We have, personally speaking, for a child with needs, it's frightening, although the staff's been amazing. But I know we have kids who have, all sorts of other issues that could require emergency care and triage, and not having a trained person, especially coupled with COVID, this just seems like a recipe for disaster.
Yeah. I know that we felt comfortable moving down to 1 because we had 1.5 when we had Eagle Lake and Wallagrass open. And when we closed those schools, it seemed like it was doable to go down to the 1 when Fish River wasn't offering. But absolutely, I could speak to Fish River and see if there's opportunity there.
Yeah, I'd like to see what we're paying for the contract, because if the contract's 5, we may want to explore just hiring outright. That way we know they're here, and not beholden to another entity that can move people.
So, for example, John was gracious enough to take my temperature today. So thank you. Is that going to be policy for everybody entering the school when the school year starts?
We're actually purchasing, what's it called?
Stand-up thermal.
That's stand-up thermal. You walk through, and it's going to scan your body temperature. We've actually ordered unit for each school.
I was just wondering if a medical assistant would be a viable alternative if we need someone to do vitals, for example, for students, and it would free up the nurse to do more important activities. So I'm not sure if that's something you're thinking about, Toby, or you want someone who's a little more advanced in their skill set.
I just want to evaluate the situation, see what we have for alternatives, and kind of take a shot at it from kind of cold. Just see how much we're paying, what we have now, assess our needs, talk to the building administrators, see how they're feeling. Like I said, I'm coming from a weird place because I have a kid with an issue, so I'm acutely aware when we don't have a nurse here. It scares the hell out of me, even though we've got really good staff, but it scares me.
If you ask your building administrators, they'll tell you they would like a nurse in each of their buildings.
I'm sure. Yes.
I weigh in just for COVID reasons specifically. So if you have, what's recommended by the AAP is if you have a child that have any symptoms that arise during the school day. So obviously, if you scream at the door, they can still in the middle of the day get a fever or body aches, cough, all the things that are a possible COVID-related symptom. There are some algorithms that can be followed to not just blanket send everybody home. Usually when things like this start, you're going to be more cautious. You're going to send the kid home with the parents, which is recommended, and the parents take care of that. But in order to do that, what's recommended is the school nurse or other health professional who's trained in putting on appropriate PPE gets a phone call from the teacher saying this child has a symptom. They go to the classroom in full PPE. They bring the child out to an isolation room that has been pre-designated, and then the parents will come get the child from there. So if you don't have a nurse per building, you have to have a volunteer that's going to be trained to use PPE appropriately. So if there are funds in the CARES Act budget, it makes sense to use them for that purpose.
Thank you. Moving on to part 7, regional COVID-19 impact. We've been told by the DOE that they're working on a regional index specific to school readiness, and they're going to have various guidance on what Aroostook County should be doing for reopening schools versus what York County should be doing. That hasn't come yet. So because we're a little impatient, we've decided to throw some ideas together now. And then when the department comes with their own guidance, we can adjust as need be. So what you're seeing right here is a snapshot, what you'll see on the main CDC website. And it does break down, it has a color legend there that breaks down different categories of COVID-19 exposure. So we just use that as kind of a baseline to put this together as some recommendations. And just so you know, we also use, and there's a link here to the CDC decision-making tree that kind of talks about, how you're supposed to decide whether or not schools can or should be in session. So we kind of use that as well as a foundation for this. So if in our regional area, and in region, we're defining region as the St. John Valley. So between our 3 school administrative units, if we were to have 0 to 5 confirmed regional cases, so essentially what we have right now, there's not a whole lot going on. We are recommending that all students are encouraged to attend in-classroom instruction and then provide remote learning for those who cannot return for various reasons that we know are going to come up. If you look at the survey data, there's some parents are not sending their children until a vaccine is out there. So we know we're going to have to provide education, and so providing that remote learning to those learners is going to be essential. If we move to another category where now, there's more exposure in the regional area, 6 to 19 is what we've identified here. We're recommending that those students who are in session, we're following the full CDC social distancing guidelines, and we're reducing our cohorts of students. We cannot fit 20 students in a classroom following those guidelines. So at that time, we would be looking at cohorts of students or shifts of students. Cohort A comes in for a week or 2 and then shifts out to remote learning. Cohort B comes in then at that time, and we follow that. Again, that's only if we move to a regional index of 6 to 19 confirmed cases. If we go above 20 confirmed cases, which would be pretty big for this region because we haven't seen anything like it since this all started, the recommendation at that point would be to move all students to remote learning, and then stay in remote learning until those cases drop below the 20, and then go backwards at that point in time. Originally, we had said that if there was an outbreak in our school, the recommendation would be for schools to be shut down for 14 days. Peter tells me that in his conversation with Dr. Hart today, there are ways to mitigate that, and limit the exposure to that cohort of students. If there's an outbreak in a 5th grade classroom, a student in a 5th grade classroom, we can deal with that cohort of students being removed from school for that point in time. It doesn't necessarily have to be the whole school. Peter, did you want to talk on that, or Dr. Hart?
Dr. Hart, you indicated that Northern Maine Medical Center either will soon have capacity or has recently developed capacity to do the non-intrusive nasal
Correct.
swabs.
So, the governor's, idea of having various testing sites that you can just come and be swabbed, even if you're asymptomatic. Northern Maine is planning to become one within a week or two. We have the initial contract, but not the finalized contract. Present a plan to them, but it should be up within a week or two. And this is an MA supervised self swab, so it'll probably be a parent swabbing a child. It's anterior nose, not up, all the way to the nasopharynx. So, according to my nephew, it won't go to your brain. This is something that the turnaround time, at least now for the state, and if the state becomes inundated, that'll change. The turnaround time for these tests for the state would be a few days. So you would be able to take a classroom, get them tested, go home until your test results are negative, and then you can return to school to minimize their classroom disruption. And that's not using it's not overusing what we have available. Testing the entire school would run through our supplies of tests too quick to make that feasible.
The nice thing about that is we don't have to have an immediate 2-week closure. We could have a quick turnaround of a few days. With students returning to school, we can isolate that particular cohort and just stress with the parents and the families for, safety's sake. This is what we need to do. We're going to get through this as quickly as possible. Here's what you can do. Here's who to contact. Here's how to, make those arrangements. And we want to work with you to get you back just as soon as we possibly can. So that's going to really, I think, change the way that we do business. We need to keep those student cohorts together, and that might mean that, some programming that is taking place in a separate classroom will now have to take place in the classroom. And we think we can practically do that at the elementary level, and it's something that we're going to need to consider for the middle high school level to the extent possible, so that we don't have to shut down everything because of an isolated case.
So
Now,
what,
has the Department of Labor been in contact relative to, let's say that you do have a teacher in that situation, and that teacher also has to be removed for 14 days or whatever, for 14 days. Now, what's the liability? I mean, does that individual have to use sick days? I mean, these are all questions that teachers are asking in terms of, what's the impact? Are they going to be using their own personal sick days for that? Or are they exempt from using sick days?
You do have every employee impacted by this virus, be it physically impacted or impacted because of childcare or other reasons. They do have access to 14 days, Lucy?
10 more days.
10 work days of leave under the COVID-19, so that you have that. Other than that, beyond that, it would be your sick leave. Beyond that, as far as I believe. Now, I do know that the Teachers Association is working really closely to make sure that they're advocating for their teachers, and we plan on meeting regularly with our association so that we have those conversations before we bring everyone back to school.
So you're giving students, staff the option to either work remotely or not,
The staff that cannot come into school
for medical purposes.
will have, it's not going to be as simple as a choice,
They have to have a exemption.
right? Yeah, it is what we're proposing. Unless that our numbers sway so far with remote learners that we have no choice, that we have to have teachers who are remote, then we'll have to retool. But based on our data right now, at about 85% on both sides, I think the two balance out.
The parents have the option to put their kids in school or not. That's up to them.
We're going to be realistic with parents that if they choose remote learning, we're going to ask that they're not next week choosing in classroom, and then the week after they're choosing remote learning. So it's going to have to be more of a long-term decision, maybe a quarter of the year, and then we can reassess, just because we can't balance that.
No, that's more than fair.
We also need to balance what we know about previous success with remote learning and make some recommendations on that basis. So there's still a lot of details that need to be ironed out. But we're going to do everything we can to make sure it's not just a capricious process.
So just so there's clarification on this, when we're talking about confirmed cases, it should be active cases, so like active cases, not what's happened in the past and are now cleared up. It would be specific to active cases in the region.
My question was on the, what type of tests? Like, whoever you were talking to about the torture test was true, but what they do now with the,
Yeah,
they go beyond your brain and back.
It does make you tear up, so pleasant. No, this is anterior nose. This is like about as far as a kid picking a booger out of his or her own nose. That's about as far as we go.
I could handle that. The other one, I don't know if I could do.
The other one, yeah, yes, my nephews were not impressed.
I wasn't either.
So on the last slide, were those standards, are those ours or those the state's?
The state has not put out a
So this is, we made this up.
This is based on the decision tree, and then using this index here, we're
It's okay for me.
recommending. No, we are recommending this because we have nothing else.
Yeah, okay. I'm just wondering where it came from, that's all.
No, that's a.
College is 3 is the magic number for the college.
So,
3 in the college or 3 in the?
3 in the
county?
college.
3 in the college, right? And so if you look at CDC's guidelines for what's considered an outbreak, it would be more than 1 student. So if it got to the point of outbreak, that's different, and then they would recommend actually closing the school. Yeah.
so do you think we should send I'd be curious what the response would be if we're kind of leaning towards this, which I take no issue with necessarily. I would be curious to see what the parent response would be if the question was, if we send them back with no social distancing,
Right.
we just go like nothing ever happened. I'd be curious to see what the return on that would be.
What we need to do is have a plan, because what was loud and clear from the survey data is, I don't know what to answer until there's a plan. But we can't have a plan unless we have data, so it's a catch-22. So we have to have a clear plan to present to parents, and then we're gonna get some real valid data at that point. My kid's not coming, my kid's coming, you know? So this is our attempt right now, and we still have plenty of time to tweak this, and this is a draft for your consideration now. And a little bit later, I'm gonna be asking you to approve that we have some kind of in-classroom presence in our schools. We don't know exactly what yet. This is a framework right now we have, but we need board approval to move forward, because if we don't have board approval, then we revert back to remote learning. We need to know from you how we should proceed. My recommendation is going to be having the 2 avenues, recommending all children are coming to school, providing remote learning for those who can't, and then adjusting accordingly based on our regional impact.
And I think it's fair to say, if they do come back to school, you know, the goal is to get as many students back into a regular school day as possible, but that's going to include a host of precautions.
And that's the issue really, is what the precautions were. Because I know when I answered the survey, it was based on the idea that we'd be following CDC guidelines. Not like, that's what I answered my question on. I probably would have answered the same, but I don't know if everybody would have.
Exactly. And there's new guidance out from the American Academy of Pediatrics.
Well, they went back and forth. They first said, open her all up, and now they're like, well, maybe not.
Yeah, but even what they said when opening them all up, having them back in school, they recommended some very specific precautions. And I think that's going to be some real practical and tangible guidance for us, and had a good conversation with Dr. Hart about that today. And I think it's fair to say you concur that that's much more practical than anything we've seen.
Yeah, the AAP guidelines and from some statewide conversations with people who advise the folks that are going to come out with recommendations. they're shooting towards more of the AAP guidelines. AAP strongly recommends that kids go back in school in person in the case such as ours, which is, there's not COVID everywhere. So in the case such as ours, there is absolutely definite real harms to plenty of students by not coming to school. DHHS is very busy right now, and it's really hard for me to watch from the office. And there's real harms for them not to be able to come to school. And right now, without any cases, there's not a good reason not to.
I think, if I may, I think that having a plan is outstanding. Having a plan, knowing that 25% of the people aren't gonna like it is realistic, and you have to deal with that somehow. And I also believe that there's no way in hell that the department's gonna tell us when and how to do it, because they never did. So I think we have to have a plan, and we need to be able to kind of stick to it if we can. If we have problems, we have to tweak it. But I think it's very important that 25% is a lot of people that don't like something. But I mean, we need to be able to say, hey, listen, for the best of education and the kids, I think that's the way to go. I like the plan already.
If I go back to the school decision tree, and what Toby said, it's not gonna be, it's not gonna be back to normal. We are still going to follow, what the CDC is saying. If we have no community spread, really focusing hard on healthy hygiene. We put in an order for all of the water fountains at Fort Kent Elementary, the ones that you have to hold to get some water. Those are all going to be replaced with ones that they can push and then wash their hands and not have to touch it again. So talking about hygiene, really, a comprehensive disinfecting and plans with that regarding cleaning our classrooms and spaces, and just really promoting a lot of these things. So we're really still pushing a lot of safety and cleanliness precautions as we move forward. The last part of the plan would be the school communication plan. We think it's going to be super important that we're communicating on a regular basis with our communities, with our stakeholders, especially with our parents and our students about what's happening. So Peter and I have spoken about this. It's going to be highlighted with a parent guide, and the parent guide will have what the plan is so they can make a determination of if their kids are coming to school or if they're remote learning. And then we'll also want to let them know that there will be regular communication this way, by this means, and this is where you go. We're thinking about possibly like a Friday update. So updating parents on a weekly basis or more if things happen and changes are happening, but at least on a weekly basis. And then refining where we're sharing that information. We find that, it's shared on this Facebook page and no, go to this Facebook page. We need to retool that and say, no, this is where you go for our district information. And that's all going to be part of this plan as we move forward. So we're really excited that we have something. We did have, Giselle and I had a superintendent's meeting on Tuesday, and when I shared just a snippet, which was this, right away they were all asking for copies. So I've shared this with my colleagues just because everyone's looking for something. And it's funny, I went home last week and my wife said, just steal something from somewhere else. And it's hard when you don't have anything to steal from because you're waiting for the department to come out with something because they say they will. But we just need to move forward and work with our own community on what's best for us. So we hope that you'll consider approving this plan when we ask you to later in the agenda.
Dad, I'd like to make a comment.
Do we have any idea how the presence or not the presence of the state of emergency by the governor is going to impact all this?
State of emergency trumps all this. Then we're back to where we've been. It's contingent on her removing that state of emergency and allowing it. Based on what's happening at the federal level, if you watch the news and what Secretary DeVos has said about reopening schools and what they're saying, that message, I think, is going loud and clear to the state levels that they want our schools to reopen. And I think in a region like where we live, I think we can do so safely and thoughtfully so that our kids are still going to be safe and our staff will be safe as well.
And I think we also are recognizing as a country that the detriments, especially to younger vulnerable children, being at home outweigh the risks, posed by COVID, at least in certain areas of the country. So I've got to think that the governor is going to be paying heed to that, because she does have a social service bent, about her. So, especially with her background as a DA and the Attorney General's there.
We get to move on?
Yeah, I'd like to say something.
Yeah.
I do have some strong concerns about, so the plan would be no social distancing when students come back to school, one of them, correct? Everyone's in the classroom, no 6 feet, correct?
There will still be physical distancing.
Okay.
And even the American Academy of Pediatrics, their initial plan, although they want all students back in school, are recommending social distancing. They are saying when 6 feet is not practical or feasible, that you can do 3 feet and perhaps achieve the same benefit. And as Dr. Hart alluded to, it seems like practitioners in the state are going to come closer to that, that 3-foot distance, which for us would make a big difference, even in terms of the number of students we can transport by a bus. When you combine that with the number of students who are transporting, number of parents who are transporting students, and the number who are willing to do so, if necessary, that's going to significantly reduce the burden that we're facing logistically.
And what's the rule on face masks going to be? Have you had guidance with that yet?
I think that for the early elementary levels, the emphasis is going to be on educating them to do it correctly. When you're talking about pre-K and K, the risk factors there, instead of using fear-based tactics, you try to educate students in the proper use of the face masks and understand that it's going to be a process, and you might have to start with them wearing it for a few minutes and then build your way up, that kind of thing. And then you're going to have similar expectations as you go up the elementary levels, but in the middle and the high school level, I think it's a reasonable expectation that students will, wear face masks. At the elementary level, the biggest emphasis is on adult transmission, and so keeping the 6 feet between adults and not having adults gathered in lounges and other places, and modeling all the appropriate behaviors about hand washing, appropriate protective face masks, how to cough into your the crook of your elbow and sneeze into the crook of your elbow.
So that's where we are as a school is going to be portraying ourselves, right? So I feel it's important, if you're doing this communication plan, that we have to communicate that to the community.
Absolutely. Yeah.
Right, and I don't think we're doing that, and a lot of feedback I get is, people, I go routinely to try to take my son for ice cream, and you go to Andy's, and people aren't wearing masks, and it's really upsetting to me with my son, and the morbidity associated with this disease is quite frightening, and I don't want to worry about it. And I don't want to do fear tactics, I don't want to do that at all,
No, absolutely.
but I want to make sure we're
But you
On
realize
the
that
same
public
page.
health has now become political. So no matter all the education in the world that we do, there will be some folks who will be marching into our schools saying, my child will not wear a mask. We have to be ready for that. And
But
that's-
I think it's more
And the
important,
response
the
is gonna
social
be like
distancing is important as well.
we will have to be ready for that. I'm not prepared to answer that question today.
So something to think about on the medical side, just so you can reassure some people. So the child to child and child to adult transmission rate is very, very low. So out of all the index cases, where you have families living together, and so this is zero social distancing, this is like sharing everything. This is your family. The kids don't tend to spread it to adults, and they don't tend to spread it to each other. They tend to get it from adults. And there's actually some scientific data to back up why that's true. I can get into the sciencey part if you want, but they just don't have the right receptors for it, and they don't start really expressing those receptors until they're like age 10 and above, and really under 12 and under really don't transmit this very well. So in addition to behaviorally, it's okay to be a little bit gentler with masking in the younger grades. It's also and not to spread it. The teachers spread it to themselves before the kids will give it to them. And I'm hoping, I'm new, okay, in my role, and I'm definitely new as the school position, the interim school position. Well, Dr. Roberts is gonna be on maternity leave, but, I'm absolutely happy to offer some of the hospital support about educating the public.
Well, I think it's more than that. Like, for example, the college is gonna be very, let's say, strict, right? Like, if you're not doing it, there's gonna be ramifications, right? I feel as if we're employees of MSAD27, when you're in the public, you should practice what you preach. And this is when I sent that email out earlier, is we need to have a strong front to say we're here to protect our staff who work here, and we're here to protect the students who come here. And I want us to be unified in that front. And so if I see someone who works at SC27 and who's not wearing a mask, that upsets me, right? If we have to be within 6 feet of one another, then may change to 3 feet or whatnot. And if it's a windy day, maybe it should be 20 feet, right? It's air slides, anyway, we can go down that route. But I really want us to be good about this. And the board can disagree with me, and I'm okay with that. This is where I'm coming from.
The staff will follow guidelines that we set while they're at work. When they're not at work, that's going to be a trickier subject. But when they're at work, they're going to be expected to follow whatever guidelines we put.
And I think that's the point that's difficult. I understand the other work piece, but it's,
We have a budget hearing to get to here.
no, that's fair too. Thank you. Thank you,
Move
Gary.
forward. So,
I did put in your packet a handout for the Valley Unified Education leadership team. Just for you to know, we're just retooling our leadership team. Our leader is going to be working very closely with our principals. So just take a look at that. It's going to be 2 leaders per building, 2 from here at CHS and 2 from the elementary school. And they're going to be working as part of that team. So I just wanted you to have that information so that you were aware of it. Just noticing my agenda is another page 2. Is yours page 2? Nope. For items of business, we have no retirements, no resignations, no transfers, no new hires, no new openings, so that's all good. For item A, we have, you could follow on your superintendent's notes, it has the item A there. The health advisor school physician agreement, as I mentioned to you a while ago, we have the agreement with Northern Maine Medical Center. Dr. Roberts, Alexandra Roberts is actually the physician that's been assigned to this agreement. Dr. Hart is filling in for her while she is on maternity leave. So we would need approval from the board to enter into this agreement with Northern Maine Medical Center.
Is there a written agreement?
Yeah, in the superintendent's notes.
Oh. So we got it. No, but I mean, like, an agreement.
Contract.
Like a contract.
Oh, do you want the agreement? I can display it on the screen, sorry.
Is this something we've had always?
No, you're supposed to have it every year, and you never really, well, since I've been here, we haven't done it. And this year, the department said, basically sent us a memo saying you should really make sure you have your school physician agreement taken care of this year, just because of what's going on.
It seems odd to me, maybe, I don't know, that we have the physician provided by one provider and then nurses contracted under a different provider, and then physician's supposed to be overseeing them. It seems odd.
I think Northern Maine Medical Center is, I don't want to say COVID ready, but I think they're,
Well, no, but we get 2 different agents.
I'm just saying, we have 2 different agencies, one overseeing another one employees. It
Yeah.
seems odd.
It's like having the state police and the sheriff's department. You think they work together, but they don't.
Northern Maine Medical Center used to be the person, the organization provided the nurse, and they had stopped it 5 or 6 years ago, I think. So they used to be,
Yeah.
and then once they determined that they didn't want to do it anymore.
Yeah.
We had to go to a different provider.
So can they tell the nurse what to do? That's what it
No,
does.
no, it's just advisory.
Okay. It says develop standing orders, what's that refer to?
The medical thing. I move we move this item to
Yeah.
the end of the list and move on with the thing and come back to it at the end.
It's right there.
551.
Yeah, I'm not gonna read this in 9 minutes off screen.
Well, I did provide you the services we provided, in.
I just like, as a board member, I don't like signing things if I can't see them.
It's on the screen, so you can do it as we move on to other.
Okay.
The second thing, or the item B, you received the, teacher recertification manual, that has been updated, and, it just needs board approval. It is in alignment with Rule Chapter 13 for the credentialing of education personnel. That changed, last year, so the team had to meet to look over and make sure that they're following the new guidelines. And the revisions are in the dark red font, which is essentially everything on page 3. And then moving from page 3, it's just adding some bulleted language throughout the document to make sure that the team is in alignment to make sure that they can nominate their teachers for a new license.
I move to approve the revised recertification manual.
A second.
Any discussion? All in favor? Unanimous.
Item C is in relation to this elementary school calendar. Last meeting we had when we made a determination to not move our high school students to a later start and skip harvest. We had some questions about elementary, and I did say that I would look into the cost of that. I asked Lucy to look into it, and busing for an extra 2 weeks is a cost of $5,592, and it covers fuel and wages because the drivers do get more hours during that time. That is essentially the full cost. And we also have 2 staff members that work in both buildings, so we would have to meet if we were to approve a change. We would have to meet and with those 2 teachers, it's Sylvia Dow Harvey and Jamie Pelletier for GT, and talk about how their schedule would work if, would they only come in half days for the first 2 weeks and then half days during harvest. We work out something with them as Madawaska does with their split staff. We posed this to the SAD33 board last night. They approved to move their elementary students. They felt that delaying the start for elementary is going to be a benefit to preparing our schools, which is similar to what Madawaska Elementary does. So I'll leave it to you guys to discuss what your thoughts are about that.
I have just one, okay, I have just one little comment. In the past, we mirrored the 2 schools because of cost. But now that basically food is free, cost is less. And are they gonna be eating bag lunches, or are they gonna eat steak and
No,
potatoes?
I don't even know.
Okay, so I would approve this. Would move to approve.
I move to approve the Port Kent Elementary School to start school 2 weeks later than Port Kent Community High School and Valley Rivers Middle School and no longer break during harvest break period.
Second.
Any discussion? All in favor? Unanimous.
Thank you. Should we recess now and then come back here after to finish the last few items?
I move to recess now and return later.
Thank you very much.
And second?
Second.
Moved by Toby, second by Kurt.
All in favor? Unanimous.
It's not.
Get used to what, writing when they're gonna check and they
You
can.
guys-
For too long.
Yeah.
Did you see that t-shirt I sent you? Oh, yeah.
I'll put something with an accent.
Uh-huh.
You need something with an accent.
Oh, yeah. Think it was the eccentric glue on it.
Or a B.
That motion.
So what's that?
I don't know what it's.
Back from recess at 6:15. Fall sports guidance.
Yep, you had received the MPA guidance on returning to athletics. It's this document right here, comprehensive document, there's a lot of information. One thing that I just want to highlight, this does not provide any guidance to the actual sports season starting. They haven't got up to that point yet. They're simply providing guidance for health and wellness over the summer months, so the athletes continue to have exercise regularly. So if you'll just look quickly on page 3, there's a section called COVID response team. That is something that we have in place with our athletic director, our nurse, and our administration. We have a team that's gone through this document, looked at the appendices to find out which documentation we should be giving our coaches, how we're going to be tracking the athletes, and so on and so forth. So that team is in place. And then if you move forward to page 4, it gives guidance on the return to physical activity, and it outlines phases 1 and 2, which essentially are conditioning, strength training, and agility. And the guidance is very specific to the students are in pods of 10 or less while at activity or at practice. This is not soccer specific activities. They're not doing anything. They're not playing games. They're not playing scrimmages. They're definitely not playing scrimmages against other communities. It's simply the team working on conditioning, getting ready in case the season does begin. There is no guidance beyond August 2, and we're waiting for the MPA to come out with the phase 3 and phase 4 guidance that starts on August 3. So right now, what I'm looking for approval is for us to follow this guidance so that our coaches can have the athletes up and doing stuff safely, so that they're not going to start a season that they're not ready for. When we get more guidance on phase 3 and 4, I'll take that back to you for further approval. So right now, your approval is not to approve the athletic season to start. You're just approving us to follow the phase 1 and 2 guidance from the MPA.
I think it's a thorough document, because the question I raised yesterday in the email, one of the things is, what's a hotspot? You know, where's that guidance? Like right now, Bolton, would that be considered a hotspot? There's some case in Marseille right now. And so, like the guidance from the college is like, I'm not allowed to go south of Presque Isle. I have to self-quarantine if I do so, right? This is all about controlling and finding if there's a case, correct? So if someone that they know is symptomatic and comes down with COVID, how do we trace and how do we find out how many other individuals may be infected? And so I think the addition of another question would be important, because I think parents' travel needs to be a concern too, right? So if a parent goes to Bangor or goes to Portland and goes out to eat and comes back, I mean, it's a hot spot. But if someone from Portland travels up here, it's not captured in this questionnaire, right? If they sleep at their house and they stay for the weekend, or they stay at their lake house all week, and the students hanging out with them all week, I think that's an important piece of the puzzle that we need to get. And it's part of what's been keeping us safe up here. It's been our isolation, but people who do travel, and it's summertime and vacation time. And so I don't know what the board's thought on that is, but I think it's something, the question, it seems like, I don't want to say it's purposely left out, but I think it's a question that's worth asking. Does that make sense to you guys?
I'm not really sure it's pertinent though, Jake, because the governor's now allowing people from New Jersey, Connecticut, New York, New Hampshire, Vermont, all to come in with no testing or anything. Massachusetts is the only real hotspot, so I think within state, I think we're good. My wife, I think it was the day before yesterday, looked, total new cases in the state for the day, I think it was 9, so. I think until something presents itself, we have an issue here that we can't overreact.
It's hard to control. I agree, the more information we have is better. I've just been working with our staff over the summer. It's so hard to control the information because, you know, someone's saying, well, I have a relative that came up and I think we hugged. I can't remember if we shook hands. Does that mean I have self-quarantine? It's like, how do you manage all of that? You know, where are they from? They're from Lewiston. Well, you know, I think you're okay, because the governor says you're okay in the state of Maine. It's so difficult to trace. It's,
The fact that it's limited to 10, I mean, that, because even if you do have an incident, we've got a cluster. I think that makes me feel.
It's that cluster while they're on the field. I think it's what I
So
mentioned
we've
earlier.
been looking around this summer, they're all clustered.
And
They're
that's,
living summer the way they have. I mean, we need to live life. We gotta sell.
if they're going to get it, it's not gonna be a soccer practice.
Right.
no,
It's
and
gonna
that's,
be at the after party.
Look at the parking lots at Parodies on any given day, there's license plates from all over the place.
no, and that's fair,
Well, the other concern I have, and I think Dr. Hart alluded to it earlier, is we know the younger children are less likely to be carriers and to contract it. But at what age do they become possible carriers, or more likely, or more prone to be possible carriers and transmitters? I'd like some more information as far as that's concerned. But then again, I don't think we should put a halt to everything.
and I'm not saying we should do a whole thing.
I think, like you said, it's a thorough document. So for the meantime, do we have a motion to move forward?
And what, to phase 3, correct?
One and two.
1 and 2, is that what it is?
Yeah. Moved by Sarah.
Second.
Any further discussion? All in favor?
In the next item. In the next item, I am looking for your approval for the presentation I gave you earlier, the in-classroom instruction. What I'm looking for in this is for you to approve for us to have a plan to bring students back to the classroom and or remote learning. So we're looking to provide what's going to work for different families. We don't know exactly what that looks like, and that's going to be, you know, further explained in the plan as we work through the summer. But I need to know that you're going to approve us to allow to bring students in when school starts, and that's what I'm looking for approval.
And right now, we don't know what those guidelines are and how many students that would be.
No, we're not approving that. We're just approving
That somebody is gonna teach something in these buildings.
We want kids in classrooms.
I want to make sure I understand what we're voting
Yeah.
on. Are we saying, yes, we want you to pursue a plan? Like, we're willing to say we're willing to move forward enough for you to put a plan together for us to look at? Because that's,
Does it include students in the classroom?
yes,
Then that's what I'm looking for.
because I don't know if I'm at the point where I want to vote blindly that we're gonna have students in the classroom, as opposed to, I think we should have students in the classroom,
Right.
but I want to see the plan.
Yeah,
Well,
That's
and
where
then-
I am.
And then the other thing is there's certain conditions that need to be met,
Oh, yeah,
right?
and things will change
I
between
think that-
now and September 1st.
Right, we just need to make that clear that this is all contingent upon the.
I don't want to plan for
Situation.
something that is not going to happen. So, yeah, exactly what you said.
Yeah.
You're approving for us to continue with the plan to bring students in and remote.
And then we'll review the
Yeah.
plan and we'll
You're not
decide.
approving the plan yet.
But we're approving, we want students in the fall in the classroom.
Yes.
Correct.
and, you know, an extreme case of that might be just the students that were flagged as remote learning did not work. It could be as small as that group.
Or special education learners, or some students need to
Some
be in.
students need to be in here.
I can support that completely. I think saying some students are going to be in school is something we can absolutely promise. And if things change, we can probably still do that.
Is that your motion?
Sure. Yeah, because we're just moving pretty roundabout, but I'll take it.
I mean, we're just moving forward, we're not
Yes.
going,
Our goal is to have people.
right,
When, and then we'll be kept abreast of the plan as it's created.
Correct.
I'll second that.
And there are school boards across the nation that are saying, we're not opening schools. Remote learning is definitely the only option. And if that's what this board is saying, say now, so that we can save ourselves some gray hair.
I don't think our numbers support that.
Any further discussion? All in favor? Unanimous?
The next item is a set meeting for declaration and computation of votes. That's because if the budget passes on the 27th, we need to meet rather quickly. Can I make a recommendation that we just move our August 17 meeting up a week to August 10? And that we can have our regular school board meeting on August 10, and I can share more of the plan with you and possible consideration for approval if it's ready at that time. And if it's not, we'll meet again, but my suggestion is to move it up.
10 days before high school starts.
August 10 works for me.
Same here.
Moved by Cody. Second by Kurt.
Any discussion? All in favor?
And then the last thing was to go back to the agreement for the health advisor. Essentially, it's providing consultation to the school nurse, participating in our wellness team, meeting quarterly with the nurses throughout the school year, reviewing our health policies at least annually, advocating for school health with other physicians as appropriate, advising the school on childhood vaccination. That's going to be a big, big thing coming up this year. Advising the schools on COVID-19, and then develop standing orders. We have agreed to a shared cost, 1/3 cost with Madawaska, and 33, we're going to use CARES funds to fund this. So our cost is going to be $1,666.66 paid to Northern Maine Medical for this contract agreement, if you approve.
That's for the year.
For the entire year.
So it's between Valley Unified and,
Yeah.
and,
Yeah.
it's Northern Maine Medical Center.
Correct. That's a value of life.
Is there more?
I think signatures. And actually, we changed the signature pages. Northern Maine Medical is the one signing, so Peter is the one who's signing on the back.
Motion to accept.
Moved by Keith,
I'll second.
second by Kurt.
Any further discussion? All in favor? Three. Opposed? Abstained?
I'm just gonna abstain.
That's it. If we need to make a motion to go back.
Before we go, can we get an update, Ben, on the, think tank discussions?
Based on what the other districts.
How the other districts are, where they are?
I think Mattawa is in the position where that, they're fearful that if an RSU is formed and they understand that the appropriate weight votes are probably going to end up favorable for MSAD communities. I tried to make them understand that it's by community, not by district. They're just concerned that that might be disadvantaged, although they don't want to end the process. They're very hopeful that it continues. I think the majority of 33 in Madawaska are concerned that this board's concerns with site selection may end up in a ask to revisit that. And I think those two boards are leery about that because of all the work that went into site selection. So site selection is going to be something that is definitely going to be hard to make any of the other two districts reconsider. the RSU stuff seems to be, they understand that that's going to happen. Not a whole lot of excitement around anything beyond 7 through 12. I've reached out to the department with our questions, still don't have answers. My next step is to send those questions to legal counsel, because I don't know the department will answer them. Specific to, can we do some subcommittees to control, you know, the elementary schools? So we'll figure that out.
Any word on, I know we had requested in the meeting that the Valley Unified itself goes to a proportional vote. The service center, or whatever we're calling ourselves now. Was there any discussion of that?
No discussion about the changing anything. So what I've done in preparation for the meeting on Monday is I printed out the ILA, and I've added an agenda item for think tank and concerns where I think that needs to be brought up. Because we did talk last March, the last meeting we had, that the ILA was going to need to be revisited on some different things like the 7 nights vote for certain things. I think that would be the appropriate time.
On Monday's meeting, I saw something for the commissioner. Is she going to be at Monday's meeting?
No, I just wanted to update you on my communication with her office.
Am I on that email chain, or is that a
That's them.
No, but that's just because I'm the chair.
chair? Okay.
Yeah, he just gave me an agenda. All right, well, I'm a little disappointed that, I mean, we kind of said what we needed as a group to move forward with an RSU. I guess I'm a little disappointed that none of things we asked for were considered.
You know, and Ben, it's not the 27. I mean, yes, we have concerns, but the split vote was a community vote, right? So I hope you're not saying it's the board that's pushing some of these items to want to change. It's the communities as well who have concerns with the split vote that we had.
Yeah, my comment was specific to what Gary and Toby had brought to the table.
Okay, all right.
What I explained to the thing here was basically exactly what you just said. A split vote isn't a pass vote, so are we wasting our time? But I think regardless of what we're doing, we're going to be vilified. So I'll put on my black hat.
Are we not coming back here?
We will vote for adjournment.
No recess?
Are we coming back?
Sarah,
No, I think she'll be done.
second by Kerr. No, in favor at 6:30.
First, second, who was first?
Sarah.
Okay, thank you.